questioning vaccines and calling for the elimination of entire departments tasked with overseeing public health. That is what Robert F. Kennedy Jr. has been doing, not just this election cycle, but also for years. And CNN is reporting that he has been seen around Mar-a-Lago since Donald Trump's win, milling about the Club Wednesday, which is now really the center of the political universe, reinforcing the views and fears of some that Trump really will task him with going wild on public health in the new administration. Kennedy has no experience in public health. He's an environmental attorney, but that has not stopped him from being one of the leading proponents of anti-vaccine conspiracy theories for years. So what does this mean? Joining me right now is Dr. Paul Offit, the director of the Vaccine Education Center at Children's Hospital of Philadelphia. He's also a member of the FDA Vaccine Advisory Committee. Doctor, thank you. Before I show some of what Kennedy's views on public health, overall, what do you think RFK Jr. having power over public health in this country will mean for this country?
Well, to be honest, I can't believe we're actually having this conversation. I mean, if you look, that science and technological advances have allowed us to live 30 years longer than we did 100 years ago. And now you have this man, Robert F. Kennedy Jr., who's a science denialist, a virulent anti-vaccine activist, a conspiracy theorist, who will have some sway over public health. Nothing good can come of that. He denies those advances. He simply declares his own scientific truths. It's a dangerous moment.
I mean, and he is a known vaccine skeptic. He has been a dominant force in promoting vaccine conspiracy theories and misinformation for years. He said in July, I want to read it, quote, "There's no vaccine that is safe and effective." But then he also told NBC News on Wednesday, "I've never been anti-vaccine," and said this, listen to this.
If vaccines are working for somebody, I'm not going to take them away. People ought to have a choice, and that choice ought to be informed by the best information. So I'm going to make sure the scientific safety studies and efficacies are out there, and people can make individual assessments about whether that product is going to be good for them.
Doctor, you're the co-inventor of a vaccine that has been recommended for children in the United States and around the world for years and has saved lives. How do you respond to what he's saying?
He said, if vaccines are working for some people, the polio vaccine has virtually eliminated a virus that caused 30,000 cases of paralysis and 1,500 deaths a year. The Haemophilus influenza B vaccine, that bacterial vaccine, has virtually eliminated the 20 to 25,000 cases of meningitis and bloodstream infections. The diphtheria vaccine has eliminated what was the most common killer of teenagers. The pertussis or whooping cough vaccine have virtually eliminated the 8,000 deaths. If vaccines are working, I mean, it just doesn't make a bit of sense. I mean, he's a conspiracy theorist. I mean, you labeled him as a vaccine skeptic. He's not a vaccine skeptic. I'm a vaccine skeptic. Everyone who sits around the table at the FDA Vaccine Advisory Committee is a skeptic, right? Show us the data. Show us the data. Prove that it's safe and effective. He's not a skeptic. He's a cynic. He doesn't believe those data. He thinks there's a big conspiracy to hide the truth, making him a dangerous man.
And that gets to the other thing that he said right there is he's talking about he wants to make sure that the scientific safety studies and efficacies are out there. You understand better than most the process of these scientific safety studies. As part of the FDA Vaccine Advisory Board, there's nothing about the approval process for a vaccine that's cloaked in secrecy.
Not at all. I mean, when we sat down in December of 2020 to discuss the two mRNA vaccines for COVID, the Pfizer and Moderna vaccines, we, the FDA Vaccine Advisory Committee, reviewed about 800 pages of data. That was all on the FDA's website. Anybody could look at those data. So nothing's being hidden. See, when he says that, when he says we need to really see the data, he's implying that data are being hidden, that somehow there's an unholy alliance between the pharmaceutical industry and the FDA to hide the truth from the American public, a truth only he will reveal. So he's basically claiming that there's a problem that doesn't really exist.
Let me play something else. He said that entire departments need to be eliminated. Listen to this.
In some categories of workers, there are entire departments, like the nutrition departments at FDA, that have to go. That are not doing their job. They're not protecting our kids. Why do we have Fruit Loops in this country that have 18 or 19 ingredients, and you go to Canada and it's got 2 or 3?
Look, with Republicans in control of the Senate, it is possible that Kennedy could win confirmation for a number of top jobs. Secretary of Health and Human Services, FDA Commissioner, the Director of the CDC. To that you say what to the incoming Trump team and the senators who might consider his confirmation?
Well, listen to what he just said. He just said that he thinks that Fruit Loops contains certain ingredients that are dangerous. Fine. I mean, and so what he should do, were he a reasonable manager, he would then go to the groups, whether it's the FDA or the USDA, and say, look, I think this might be a problem. Let's look at this, right? And then look at the data, because I'm sure there are things they know that he doesn't know. And then if there is a problem, it can be investigated and fixed. You don't just eliminate agencies. But when he talks about eliminating agencies, he's tipping his hand for the fact that he's a conspiracy theorist and he thinks that all these groups are lying to the American public. I worry about him greatly, but I don't think he could really be confirmed as head of the CDC. I just can't imagine that people would, knowing what he does and knowing what he says, would confirm him for that position. What worries me is that some of his anti-vaccine cronies, like Dr. Joseph Ladapo in Florida, would be confirmed for that position, because at least Ladapo is credentialed. He's an MD, PhD from Harvard, but he too is a virulent anti-vaccine activist, as he's shown in Florida. I worry for this country's children.
Dr. Paul Offit, who has spent his entire career trying to take care and saving this country's children. Thank you so much, Dr. Offit.